Yes, it's a phase 2 study with a combination of standard chemotherapy with cytarabine and idarubicin plus Selinexor in patients with relapsed refractory AML. These patients are a very difficult to treat group. They have a very poor prognosis, especially if they have an early relapse after initial chemotherapy or it may relapse after allogeneic stem cell transplantation. And there's still no universal salvage chemotherapy for these patients. Therefore, new schedules and new drugs are desperately needed. And that's the reason we conducted the study in combination with Selinexor. Yes, maybe one word for the rationale. There's a strong synergy between Selinexor and anthracyclines, this has been proven in vitro in many patient samples and cell lines. So this was a rationale for the study. And this was a phase 2 study with standard chemotherapy, cytarabine, and idarubicin plus Selinexor. And 42 patients were included. And at the beginning, we had a relatively high Selinexor dose of 40 milligram per square meter twice weekly for 4 weeks. And this was accompanied by relatively strong diarrhea and also prolonged aplasia. And this was the reason the dose was reduced throughout the study by an amendment, and the lower dose was then 60 milligram absolute and per square absolute twice weekly for only 3 weeks. And this resulted in a much more tolerable regime, and the patient could be treated in this way. The primary endpoint was the rate of remissions or complete remissions or CRIs or morphological leukemia-free state. And secondary objectives were partial remissions, percentage of patients being transplanted after the chemotherapy, and relapse-free survival and overall survival, as well as toxicity, of course. The primary objective was the determination of the response rate, and this was 50% for the whole group of 42 patients, combining both dose levels. And this is a relatively high response rate compared to other published series, especially in the view that the patient cohort had many negative characteristics, such as 40% of the patients had received prior allogenic transplantation, and 60% of the patients had a relapse after primary therapy within less than 1 year. So this response rate is really in the upper range of expected results, and the overall survival was 8.2 months for the whole group. Yes, that the combination is relatively tolerable at the lower dose of Selinexor. Hematotoxicity and GI toxicity is tolerable, acceptable. So this could be a regimen for further testing. And so, of course, the results have to be repeated in larger randomized phase 3 studies. Yes, patients with primary and secondary AML had similar response rates, especially also patients with relapse after allogenic stem cell transplantation, but still patients who had a short first remission had a worse response rate, as well as patients with adverse cytogenetics. Interestingly, 3 or 4 patients with NPM1 mutation had a complete remission, and there's some basic research rationale. Mutated NPM1 is also exported into the cytoplasm, and this might be retained also by Selinexor treatment.